Start.
Hello, this is Dr. Khan, one of the doctors in this today's admission unit. Uh, may I confirm your name and age, please?
Doctor, my name is Steve Wright and I am 25 years.
Okay, and how can I address you?
You can call me Steve.
Okay, Mr. Steve. Today we are here to discuss about your health condition, and our discussion today will be totally confidential between us. Is it all right?
Okay, doctor.
Uh, okay, at first, may I know how are you feeling now?
Not so well, doctor. Actually, after the last night, I am having the problem, though a little bit. I am
Mm-hmm.
having chest pain.
Mm-hmm. Okay, and as you have mentioned, your chest pain started last night, and can you tell me whether you had this kind of pain previously?
No, doctor. It was not previously. Just started last night, and it started. I went on a party with my girlfriend, and after
Mm-hmm.
leaving the party, I take some food. That was around 2
Okay,
a.m. And half an hour later, after taking that, I vomited a couple of times.
okay,
And that I vomited in the street, and I felt some racing after the event. And then
speak a bit louder.
I noticed severe pain
Okay,
in the center of my chest after that event. And
okay.
that pain somewhat relieved by taking paracetamol and ibuprofen, but that didn't go away. And
Mm-hmm.
yesterday night, I couldn't sleep due to this pain that bothered me much. So I visited
Mm-hmm.
my GP in the morning, and he
Mm-hmm.
did some electrical tracing of my heart, and he said that it was normal.
Mm-hmm.
But he is not quite sure that what is happening with me, so he sent me here.
Okay, okay, I understand, Mr. Steve. So as you have mentioned that you went to a party, so may I know whether you drank alcohol in the party?
Yes, doctor, a bottle of wine.
And and did it started after drinking alcohol?
Not immediately after drinking alcohol. That was somewhat maybe half or 1 hour after that drinking,
1 hour?
or half hour.
Okay, and can I may I know how much you did drink?
At the party, I drank about a bottle of wine, but I drank a larger in the pub before attending the party.
Okay, I understand. And may I know whether you drink alcohol regularly or not?
Yes, doctor. I usually drink 1 to 2 pints per day whenever I can afford.
Okay, okay, all right. And one thing in particular that you have also through your notes, I have been informed that you have some nausea and vomiting as well. So, uh, do you have this problem of vomiting uh, before your pain, or it's happened after your pain?
It's happened after vomiting. The pain came after vomiting.
Okay, okay, I understand. And how many episodes it occurred last night? Episodes of vomiting?
I cannot tell you exactly, but maybe 5 to 6 times.
Okay, and did you notice any blood with your vomitus?
Yes, doctor. That was a worrying thing that in the last 2 times I noticed that I am passing some red blood.
Okay, and your chest pain started after the vomiting
Yes, doctor.
episodes have resolved, right?
Yes, doctor.
Okay, and May I know, as you have mentioned, your pain is in the center of your chest, and does it radiates anywhere from there?
No, doctor.
Okay, and how about the severity? As I'm telling you, like 10 means the worst pain you could ever imagine, and 0 means no pain. How do you grade this?
I could say it about 5 to 6.
6. Okay, okay, all right. And uh, may I know that uh, is it still the same from the beginning, or it's gradually increasing
No,
from the
doctor.
moment it is started?
After vomiting, the pain was somewhat more, and the pain somewhat decreased after taking the ibuprofen and paracetamol, but that didn't go away as I expected, and that hampered my sleeping last night. But it is
Okay,
somewhat less from the beginning.
okay, I understand. And have you noticed, as you have mentioned, it's less after taking uh, your drugs, ibuprofen. And have you noticed anything that is causing your pain gets worse?
Yes, doctor. Whenever I take a deep inspiration, then the pain become worse. And also
Okay.
somewhat if I take something uh, food or any drink, then it becomes somewhat
Mhm.
difficult for me.
Okay, as it is just increases after inspiration, right? All right. Okay, Mr. Steve, have you noticed any if it's breathlessness during this period, like you are cannot take breath, not like normally?
No, no,
Okay, and any cough?
no,
Okay, any high body temperature
no.
last night? Okay, as you have also mentioned, vomiting and nausea, and that has it been resolved now?
Yes, doctor, that have gone.
Okay, that's excellent. And do you have any tummy pain now or during this period?
No,
Okay, any loose motion during this
no,
period or change? Okay,
no.
what about your water work?
It's okay.
Okay, and have you noticed any shakiness or loss of consciousness during this period?
No,
Okay, okay, all right. And uh, do you have any past known medical conditions?
no, doctor, I don't know anything.
Okay, do you have any family history of cardiac problem, or any members of your family have some issues with chest pain?
No, I don't know this, but my father had a heart attack about 5 or 6 years ago.
Hmm. Okay, and at what age?
Maybe around 60.
Okay, I understand. And do you use any medicine regularly? Drugs?
No,
Okay, it may be some any over-the-counter medicine or herbal medicine.
no,
All right, and do you have any problem with the pain of your joint?
no,
Have you noticed any swelling in any parts of your body?
no,
Okay. Have you ever noticed any clotting problems like in your leg or in your lungs?
no,
Okay, okay, I understand. And okay, so another things in particular that do you have any soreness in your mouth?
no,
Okay, any visual problem?
no,
All right, and have you experienced any other problems after drinking alcohol, like recurrent, repeated episodes of tummy pain, or sometimes you have mentioned that you have vomited blood with your blood this time. So have you ever previously vomited blood other than this?
no, doctor, never.
Okay, and have you ever noticed any black tarry stool?
No,
Okay, any yellowish discoloration in any parts?
no,
Okay, any tingling or numbness in your limbs?
no.
Okay, okay. And may I know whether you drink, you do you smoke?
Yes, doctor. I do about 10 sticks per day.
Uh, okay, Mr. Steve, smoking is bad for health, and if you want, we recommend to quit smoking. And we have a good team, so we can help you in this regard.
Okay, doctor.
And again, as you are drinking heavily, I recommend you that you can it will be good for you to reduce your drinking if you wanted.
Good.
Okay, Mr. Steve, may I know that whether you use any party drugs, maybe through your nose or maybe through your blood channel?
Yes, doctor. I take ecstasy last night when I arrived at the party, and usually when
Mm-hmm,
I get a time, I usually take some cannabis
mm-hmm.
when I can afford it. And also yesterday I smoked a couple of times cannabis joints.
Okay, I understand. And Mr. Steve, and is if you wish, we can help you in this regard also, because this may be sometimes very dangerous for your health and even for your heart, because it can hampers your blood channels of your heart. Okay, so if you wish, and we recommend that it is essential for you to quite taking these drugs.
Okay, doctor.
Okay, and do you have any allergy to any drug?
Yes, doctor. I have allergy to penicillin.
Okay, understand. And again, what about your mood, personal mood? Are you having any mood issues over the time?
Yes, doctor. I have a bad relation with my family. For the last
Mm-hmm.
15 years, I am not in a good relation with my family.
Mm-hmm.
That makes me bother. Though I sometimes
Mm-hmm.
visited my elder brother, but I
Mm-hmm.
usually rarely visit my parents.
Mm-hmm.
And also, I am not having a
Okay,
good
Mr.
in a job, in a regular job. That also
Mm-hmm.
is a great problem for me.
Okay. Okay, Mr. Steve. I'm really sorry to hear that, and to let you know that we have a very good mood doctor, and we are here to help you, and we'll talk to the mood doctor so that he can help you in this regard. And again, may I know whether you will be happy to take any social support or financial support?
Okay, doctor. If you can arrange, that will be fine.
Okay, and all right. And may I know, Mr. Steve, about your any other issues you mm, want me to address?
No, doctor.
Okay. So, all right. And so, Mr. Steve, at this point, as you have mentioned that you are some chest pain from the last night, along with vomiting and nausea. Okay. And you have also mentioned that you have some couple of liters of blood with your vomitus. All right. So, uh, okay. Again, another thing is that you have mentioned you have some problem with your mood, and you are recently using, uh, taking more alcohols and also some party drugs as well. Am I right, Mr. Steve?
Yes, doctor.
Okay. So, Steve, one thing I need to issue, it may be some personal questions, but may I know whether you are sexually active or not?
Yes, doctor. I am living with my girlfriend for last 5 years.
Okay. And uh, uh, do you have any other sexual partner?
No.
Okay, all right. And all right. So at this point, may I know what are your concerns, Mr. Steve?
Yes, doctor. Is it a heart attack?
Okay, Mr. Steve, I I understand your concern, but based on your history I have taken, I am worried about a condition that may be related to your vomiting. Like as you have vomiting several episodes after drinking alcohol, so maybe due to your forceful vomiting, your food pipe may got some injury, and that may cause your chest pain. But to be more precise, we may need to investigate you with imaging of your food pipe so that we can understand whether it really happened or not. And as you have also mentioned that you are using party drugs as well, so we'll keep you under close observations, and we'll also run some blood tests to check whether any of the hearts got involved with this, as well as sometimes these party drugs can affect our blood channel of the heart and may cause an heart attack. But as after taking your history, we consider this less likely, but we'll see after the report that's what is happening.
Doctor, do I need admission?
uh, okay, at this point I think we, as we are still not confirmed, so we'll keep you under observation until a further blood test is arrived, preferably the cardiac troponin I level, we can say that. And after that we can discharge if it's normal and do some other test if it is available within that time.
Doctor, will it be cured?
Okay, at this point, we think if you can reduce drinking, and it's likely that it won't happen again.
Okay, doctor, thank you.
Okay, thank you, Mr. Steve. It's very good to talk to you.
Okay, so what are the differentials you have?
Okay, as this young gentleman of 25 years, presented to the clinic with the complaints of chest pain for the last night, along with after episodes of forceful vomiting and nausea, and that was followed by taking by a large team. So I am really worried about a condition called malodiosteer that may cause his chest pain. But secondly, I will also consider cardiac cause as well as sometimes party attacks, like using intravenous drugs that like cocaine may cause coronary vasoconstriction. So I will also consider that as well, and will run troponin level. That's my two differential.
Okay, how will you investigate him?
So as this patient, I will do a cardiac troponin and serial ECG, and for diagnosing malodiosteer, I will consider an upper J endoscopy as well. And as this patient is chronically alcoholic, so I will also wanna check his liver function test, whether any abnormalities there, and his blood lipid level, which may be altered, along with renal function as a routine investigation. I will also uh, consider a chest X-ray to see any. Particularly, one thing may happen is that, though it's very unlikely, that, that forceful vomiting may cause some esophageal tear as well, and which sometimes may lead to poor have syndrome. This is very unlikely though, this young patient, but that may be a possibility. Okay, the difference is like,
Okay, thank you.